We speak. Our words. We listen.
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 Well, hello, everybody. We're returning to one of our threads, one of our conversations, the thread about behaviourism, ABA, PBS, all the words that go with the field of study that looked at the way human behaviour can be used to help people. But, as we all know, there's controversy around behaviourism and ABA in the autistic community because of some of the historical ways that applied behaviour analysis has been interpreted by some professionals in some parts of that community. That's why we think here at Autistic Radio, this is one of the important conversations we have to have. We have to speak to those people who use behaviourism, those people who study behaviourism, those people who apply behaviourism to us, and get to understand where they're coming from. We also feel that if we have an open conversation with behaviourist people and behaviourist researchers, that we might have the opportunity to change something. We don't know what we want to change, necessarily, but we know that we feel that if we can, as autistic people, put some input into the way things develop, that everything can be improved for everybody. Today, I'm really happy to be speaking with Suzi. Suzi Sapiets is somebody who was introduced by our colleague Andrew Swartfigger. Suzi is autistic themselves, but also has an association with behaviourism. Hi Suzi, how are you today? Are you comfortable where you are?
Hi Jules, I'm good, thank you. And thanks again for inviting me to join this discussion. I think I'm comfortable.
Well, that's good. So Suzi, I think the first question that comes to mind today for you, Suzi, is that you're autistic and you're also a behaviourist. How do those things work together?
Today I'll be speaking based on my experience and not on behalf of the wider sort of autistic community and practice community, including behaviour analysts. To clarify, I'm not a behaviour analyst, but I have worked along organisations and professionals who have used behavioural approaches supporting individuals with learning disabilities and autistic people. I do have some experiences as a support worker and assistant psychologist, where I worked directly with children and young people who are autistic, have learning disabilities or other neurodivergence. I have been involved in research and writing around behavioural support, in an evaluation of the PBS Academy, analysing data collected by a charity on the use and impact of restrictive interventions in schools, writing on the revised definition of positive behaviour support, and other sort of behavioural support like teaching children reading and handwriting.
Okay. So would you say that you're a researcher who is trying to inform the behaviour support community?
Yes, yeah. So I think I'm trying to work with some behaviour analysts. I am a researcher and as an autistic person working to try and help improve behaviour analysis by working with behaviour analysts, although I'm not a behaviour analyst myself.
Excellent. So from my point of view as a layman, I can see you as a bridge. I can see you as somebody who understands their own autism from their own point of view, as far as that's possible to do, but also somebody who's reaching out to the behaviourist community, yeah?
Yeah, and I have received behavioural support myself as an adult.
Okay.
I had cognitive behavioural therapy through NHS IAPT services. That was before I got my diagnosis. And since my diagnosis, I've actually participated in some studies that involved elements of behavioural support. So studies that used elements of cognitive behavioural therapy for autistic adults, and also a study on adapting acceptance and commitment therapy for autistic adults.
Wow. So it sounds to me as though you've already been out there making a difference. Have your suggestions been taken up by the behaviourist community?
I've only worked with a small group when you consider the wider community of behaviour analysts in the UK. I've only worked with behaviour analysts who will take on board things.
Right. Okay. It sounds to me as though you're saying that there might be a community amongst this large community of behaviourists that are able to accept autistic input and maybe some that aren't. Is it a minority or a majority that are able to take some kind of input from us?
From my experience, it would seem like a majority, but that's just of the group I've worked with, which in the grander scheme of things would be a minority.
Oh, okay. So it's the majority of the minority that you've dealt with.
Yes.
Right. Okay. So you don't feel able to comment on the whole community. It's just your experience might be more specialised.
Yeah, I mean, it's tricky to say on the grander scheme of things because I'm limited in the amount of people I have interacted with, but those I have interacted with have mostly been really open to developing and improving behaviour analysis and critically analysing things or applications they were taught years ago that now they're realising is not appropriate or ethical, such as things like increasing eye contact. So realising that that's not appropriate. And I work with people who have a focus on the rights and values and not trying to change neurodivergent people, but trying to support them to have the best life they can.
Wow. It's interesting that you mention eye contact, because forced eye contact has been one of the obvious signs to autistic people that behaviourist principles don't feel right for them. The forcing of eye contact is something that's really often mentioned by those who, as part of things like Stop the Shock and people who are actively campaigning against ABA in the United States, forced eye contact is the issue, and you bringing that up straight away, that's interesting.
Yeah, so I would say that forcing eye contact is not a behaviourist principle, but it is an application of behavioural science. And there is a wider society around those sorts of social skills interventions. And so sometimes behaviourist applications have been used, but it's almost like the wider society was selecting these sorts of things as targets for interventions rather than them being behaviourist principles, if that makes sense.
Eye contact for many autistic people is one of those really essential parts of who we are. Not feeling the pressure to maintain eye contact with other people is one of the ways that allows us as autistic people to feel more naturally ourselves. So how does eye contact come into behaviorism and the application of behaviorism? Where does that come from?
I think historically, behavioural interventions have been used in a way to change people. Part of that included things like social skills training and forcing eye contact. But now, as neurodiversity is growing in awareness, we do know how harmful it can be to force people to make eye contact and how that can actually impede communication with others. I can't really pay attention to other people if I'm trying to focus just on their eyes, because it's very distracting and overwhelming. And so there are behaviour analysts who are realising that some of the interventions they were doing years ago may have been having that sort of harmful impact.
Okay. When we were talking earlier, you were saying that maybe it was the demands of society for normalizing autistic behaviors that led to behaviorists applying and concentrating on these traits, these obvious traits, to try and eradicate them. But now things are changing. Would that be a fair summation?
I do think that behaviour analysts may have been using things like trying to encourage eye contact because at that time they thought that that would be helpful, so that would help an autistic person to communicate with others, whereas now understanding has grown and we know that encouraging eye contact will have the opposite effect, and so it shouldn't be used at all.
Harry's making a very good point in the text there. And I think it's something that we as autistic people identify with, that as we were children, not giving people eye contact was misunderstood as a lack of attention. And what I've seen through ABA is this constant request for attention from the practitioner who is training a child. Does that still go on?
It shouldn't if behaviour analysis is being applied appropriately. We should really be focusing on what the children are enjoying. If we want their attention, getting it appropriately by engaging in their interests and things they enjoy. I do agree that a lack of eye contact was misunderstood as a lack of attention. And I do think I find it easier to pay attention if I'm not looking at somebody's eyes. So it's actually great to not be looking at you on the camera now.
Yeah, exactly.
I do think that from my experiences, if they're used for supporting someone's behaviour, it should only be used if it meets a definition of behaviour that challenged by Emerson and Einfield in 2011, which is if that behaviour has a significant risk of harm to the person, other people, or a significant impact on their quality of life. So not about changing just any behaviour based on neurotypical or societal standards. So things like stimming, if it's not harmful and it's helpful to the person, that shouldn't be changed. But if they are, for example, stimming in a way that's causing them self-harm, then that might be something to explore on how to support the person. And behaviour analysis should use a biopsychosocial model to understand why that behaviour is happening. So looking into different sort of vulnerability factors like physical health, pain, sensory, psychosocial aspects like negative life experiences and how the person communicates and their mental health, if they're being engaged in meaningful activity, how their social networks are. And then there might be maintaining processes. So sometimes the behaviour could be something around pain reduction. It can also be because of other people's behaviours. And this is actually where a lot of the work I've been involved in has focused. It's on changing that maintaining process of other people's behaviours that is causing the person or other people harm. In my work, in my reading and writing, it's been around a focus on changing the environment and other people's behaviour around that person, such as their family members, friends, staff supporting them, rather than changing the behaviour of that person. So often it's something in the environment or something other people are doing that is causing someone to become distressed and do things that, other people find challenging.
Wow. Suzi, you're turning what people understand as behaviorism on its head here. Everything you say is coming from the understanding of autism through neurodivergence. Everything you're saying is coming from the social model of autism. And I think a lot of people in autism who are looking at behaviourist principles or using behaviourist principles are going to find that a surprise. Am I wrong to think that?
I'm not sure. I think, unfortunately, our society uses medical model way more than social model. So thinking about when we understand or begin to recognise a potential need in a child or adult, they then have to get a diagnosis in order to get support. And the diagnostic criteria is so medicalised and so medical model, focusing on deficits and difficulties rather than just natural differences in human brains and bodies. And so a lot of professionals training, especially if they've been professionals for a very long time, will have been based on the medical model perspective. But now things are changing and people are starting to, look at the social model more, and hopefully that's being used in training so that people are actually starting to understand that it's a natural difference and that we're all diverse.
Yeah, we are. It's interesting to me because the little I know about investigation into behaviorism at the turn of the century and into the 1950s, it looked to me as though the social model was there right at the beginning, that the people who were putting forward behaviorism were trying to explain behaviors based on a more holistic approach and the environment around them. That looks how it was started as a human investigation. But quickly it appeared to pivot, and it appeared to pivot to a kind of training model There's a very famous statement where somebody said that they were going to, if you gave them a child, they would be able to mould them and make them into any version of human beings, whether it be a criminal or a senator, you know? Did behaviourism lose its way somewhere?
There is no denying that there has been very inappropriate applications of behaviour analysis. That they've used things like punishment and aversives, which shouldn't be used as part of behavioural support. And sometimes these things might have been inadvertent. For example, giving someone praise can be aversive, but it's often used just for children without any thought. And so there definitely has been inappropriate applications and abuse under the name of ABA or behaviour analysis.
So that's why we keep seeing different names put forward. Behaviourism seems to keep changing its name and changing its acronym constantly as I look at it, as though it's hiding from bad press even.
I'm not entirely sure about that, because there are differences between ABA and PBS. But behavioural science is a very broad topic and it can be applied in very, very different ways. There are ethical and good applications, but there are also unethical and abusive applications, and that we know have taken place, as we have seen.
What we talked about is demonstrating why there is a lot of suspicion and fear that punishments. The negative approach, many professionals trying to basically slap autism out of people. That's not the way you should be. You should be normal. Although we all know that there's no such thing as normal, but there's this sort of normal that many people are trying to work towards, even though everyone and everybody's brain is different.
Yeah, I completely agree with you, Harry.
The medical professional, the medical model that's been spoken about, the unethical practice of behavioural analysis is basically trying to or looking to slap autism out of people, particularly children. It's like this unrealistic target of normalising people, although there's no such thing as normal. And it's good to know that you know there's other practices out there that are totally against that and that look towards the more human side and realising that all brains are different and stop punishing people for who they are. That's what I was kind of raising, really.
Yeah, and I completely agree with everything you've said.
Well, it's difficult to disagree with somebody who says stop punishing people. I think we all agree with that. I think where most people who are autistic have a problem with this is that the people we're speaking with at the moment, Suzi or Andrew or the other people I have lined up, they come from a very progressive part of behaviourism. And I think that they are worldwide a real small minority. Because when I go to a main conference like a Colicon in the United States, I can go to lecture after lecture that explains using techniques of withdrawal of somebody's favourite toy, or how to gain eye contact, how to enforce eye contact on children for periods of time. And it's absolutely current now that all of these techniques are being used. But this is a minority that we're speaking to, the people who are not just more open-minded, but perhaps more holistically thinking about what behaviourism started as a human inquiry in the first place. Did I say anything that you would disagree with there, Suzi?
No, I think there are definitely people out there who are still using behavioural approaches inappropriately. Ultimately, the aim should always be to improve quality of life, be that through teaching somebody a new skill like reading or writing, communicating key things like and needs like yes, no, food, drink, toilet, gaining agency and control. These are the things that should be the aims or the goals of using any approach, and not, as Harry was saying, trying to make people appear normal, because there is no normal. And if we're going to be doing that, there is going to be a mental health impact. I didn't receive behavioural approaches as a child, but I definitely did change my behaviour. I'm not sure if it was consciously or unconsciously, but in order to sort of fit in with other people, because of, things like bullying and, not feeling like I fit in. And that, did have an impact on my mental health. And so getting my diagnosis and having a journey of self-discovery and understanding, why I find some things difficult has really been so helpful for my mental health.
That's really interesting, the way that you frame that, Suzi. I think a lot of us as autistic people will recognise what you said there about learning yourself as a child how to fit in, how to keep your head down, how to avoid the bullies, and how to adapt yourself to society. And we all have to do that to some degree. All children have to adapt to the society and the culture in which they live. However, that can be overly oppressive for an autistic person. And in the past, ABA has definitely been part of an enforcement of the norm on children. But now you're talking around that and you're saying that a more full understanding of behaviourism and it not being applied to you, rather you using those principles, has been something that has helped and guided you. Am I picking it up correctly there?
I think so. Yeah. I don't think I consciously used behaviour approaches to improve that. Although, actually, I'm going to change my answer and say yes. I did actually consciously use behavioural techniques, from cognitive behaviour therapy to sort of help me grow and develop after those negative experiences of either unconscious or conscious masking in childhood or as a young adult.
I recognise that. What I used to do, and still do to a certain degree, is I used to overthink and plan for the future and plan for things that may happen. I'm dreading it's going to happen, and I'm talking weeks, months away that I might meet a certain person and how I deal with it. But I got involved, or I was referred to because I asked for it. I was recommended, actually, cognitive behavioural therapy. And what I liked about that is that it made me learn to appreciate time more, like appreciate the presence, rather dwelling on the past too much and over planning for the future, which I generally used to do. And I had my diagnosis of autism at the time as well, so that came all into it, and the discussion, and wasn't anything too brutal. It was just a nice discussion and making sense of a lot of things. I don't remember the details, but what I do remember is the therapy itself was nice, gentle discussion, and basically recommending and helping me not to be so hard on myself, rather than me changing behaviour for other people. So, and that certainly did help me a lot as an adult.
Yeah, and that's really positive to hear. And I think lots of autistic people have benefited from cognitive behaviour therapy. But as with any mental health support, it needs to be sort of individualised to the person, and you need to have a good relationship with the therapist. I was very nervous when I started CBT, and my therapist was a trainee, but they were so amazing and they really helped me overcome my anxiety, even just talking to them. And they didn't force me to make eye contact with them. They used, like, they would have a piece of paper where they'd show me stuff to sort of use me to focus on that, to help me not feel so anxious, if that makes sense.
Yeah, I could identify with that. It's, you know, luckily for me, the therapist that did this CBT already knew them through a mental health group that I was involved in, so that helped that relationship. That I knew them already, for a couple of years. I just find it interesting talking about that experience, because that experience was like 20 years ago. And usually when we're talking about something happening in the past, like that sort of time, like 20 years ago, it's like it's usually not the greatest experience. It's usually something as an example that you want to change. But at least that example that I've given anyway is a good example, and I would hope that today would be a lot better for people. But it's individualised, as you say. It's been very beneficial for me. Appreciating the flow of time, meaning that the flow of life. I know it's kind of be a bit over poetic here, but that's what made me appreciate, living, just living and not overthinking and planning. I think a lot of autistic people will have issues with in terms of dealing with life, over preparation, as we've talked about before, and sometimes overdwelling, because there's been a lot of injustices for a lot of people in the past, a lot of traumas that it's hard to get over. And I'm more, you know, luckier than other people in terms of what bad experience I've had, in terms of people have had worse. But it's that sort of kind of therapy and that talking. It's basically feeling like you're talking to a friend, I felt, because I knew the person, you know, a lot long, well before the therapy itself. So it didn't feel like therapy, it just felt like you were talking to someone, and it's actually therapeutic in that talk. Because when I speak to like some friends and all that, it's the sort of approach I do myself in terms of if someone needs advice, etc. So, yeah.
It's interesting to me that we started questioning a little bit about how behaviourism appears in the United Kingdom. We've moved to CBT. Is CBT seen as part of behaviourism, Suzi?
Yes. CBT, cognitive behaviour therapy, does include aspects of behavioural science. So yes, it is part of behaviourism.
I have spoken with people who have reservations over CBT. And in the same way that people would have reservations over some aspects of ABA, it looks to me as though the letters CBT cover quite a variation in the way practitioners work, and Harry's describing one of the advantages is that there was a trust with a particular person and a practitioner. So I think, just for the sake of caution, I wouldn't want anybody listening to this to think, fine, all I need to do is find the correct CBT practitioner, or all I need to do is find the correct behaviourist. It might not be something that is quite such a simple fix. Was it reasonable for me to say that, Susie?
Yes, of course. So CBT isn't always effective for people. I can say that my experiences of CBT have been mixed. The first time I received it was amazing and transformational. Years later, when I was struggling again, I was referred for CBT again with a different therapist. I didn't have the same connection with that person or therapist, but it didn't really help me at that point in time. So I think people listening who maybe are interested in seeking support for their mental health, I would say that CBT can be helpful, but if it isn't helpful, that doesn't mean that other support isn't going to be helpful for you.
So you're warning people, you're saying if CBT doesn't work for you, move on to something else.
Yeah, or maybe even try to find another therapist, because sometimes it can be about that sort of relationship. There is something called the neurodivergent therapists, which have a UK and Ireland directory of therapists who either are neurodivergent themselves.
Yeah, I think we need to come towards a finish now, Harry.
I like how the conversation has gone, though. It's just got a natural flow to. I mean, the CBT, when I was talking about, it's just that's the only thing I've actually experienced. So it's just good, that's actually seen as part as of behaviourism, because I wasn't entirely sure if it was or not. So at least it kind of adds into the conversation.
There are different types of therapy that can help people overcome difficulties that they might have experienced being autistic, growing up in a world or society that isn't accepting, understanding, or accommodating. For me, identifying the cause was useful, and so identifying that trauma has played a part in my mental health, and getting support from a therapist who works in trauma therapy and who is autistic themselves has been really helpful. That it doesn't really involve any behavioural science, but I think as a lot of your listeners are autistic, that's something I'd like to share, because it's really transformed my life.
That's lovely to hear. Well, what we've heard today, we've heard Suzi is studying at a high level, and she's autistic and involved in behaviourism. She's telling us that it's a very wide field, and that modern behaviourist principles are different from the kind of things that have been embedded. Unfortunately, when I say it looks to me as though those old-fashioned practices are prominent, I don't think Suzi is in a position to say that they're not at the moment, because her experience is much more modern, much more based on a group of behaviourist scientists and behaviourists and analysis people that are looking to the future, and they're looking at the neurodiversity model. I don't want us all to go away thinking that when we have one professional, that the way they describe the world is the same for everybody, because it obviously isn't. But it's an insight, isn't it? I really hope, Suzi, that some of the other questions that we've talked about, your experiences with behaviour analyst in your personal life, we've touched on a little today, but I think there's more to talk about there. And whether behaviour analytic approaches improve people's lives, you have another opportunity to come and speak with us and explain that to us. And I feel that there's another topic that you have pointed out that would be good for us to talk about in another conversation, and that is, what has your experience been engaging with behaviour analysts in your work and research? So is it possible that we could come back to those questions at another time with you, Suzi?
Yes, of course. Thank you. Okay then.
Okay. Suzi, it's been lovely meeting you. I'm sure Harry feels the same, and we're going to talk again, and we're going to get this conversation, this really important conversation between autistic people and behaviour analysts and the behaviourist community. We're going to get that happening. Thank you for joining us today, Suzi.
Thank you for having me. And yeah, I look forward to talking with you again in the future.
Yes, thank you.
I think that's a suitable ending.
Autistic Radio is personal and it's informal, which means that those taking part speak only for themselves. If they mention an organisation that they work for or that they're a member of, they're not speaking on behalf of that organisation. We shouldn't take any implication from that. It's also the case that people's opinions change over time. So while this recording is there forever, people change.
We are very fortunate to have the cooperation of autism professionals here at autisticradio.com. It's a conversation in the Explain Me Autism series. There's so much to know, and nobody knows but a few pieces of that enormous puzzle. Sharing your thoughts as a professional and your experience, and in return having us share back with you some autistic insights, is what we're doing here. It's an open conversation. Please be one of those professionals or those advocates or those individuals who are willing to have a conversation explaining autism